Welcome to Adapting Class. When the NCLEX asks you about what is the next step intervention, it sounds tricky, or what is the best care? All they asking you is to be safe. How do you do that? Is to use common sense and ask yourself if this is the rare patient. In this video, 11 good question on basic care and comfort. And we're going to use good old-fashioned common sense and critical thinking based on the stem of the question. So let's get to it. First question, what is the next best action? All of the answer choices are right. A nurse is caring for a client receiving oxygen by what? Nasal cannula. The client says their nose feels dry and irritated. So let's go for the buzzword as usual. Straightforward, best action. My nose is dry and irritated, and I'm getting oxygen. What are you going to do? Stop the oxygen for a few hours, apply water-soluble lubricant to the nurse, switch to what? Face masks, or use petroleum gel. Stop the video, put it back on, and see the way I'm going to approach it. I've underlined the buzzword in the question and the buzzword in the answer choice. Then I ask myself, oxygen and petroleum are not friends. Fire, fire, fire. Common sense tell you petroleum gel is going to do what? Ignite with oxygen. Even if you don't know, petroleum is gas. I don't care about the jelly. Petroleum, fire. There's nothing in the stem of the question that tell you you need to change to face masks. Even face mask is uncomfortable. It's not comfortable compared to nasal cannula. You want a patient to receive oxygen in a comfortable way, right? Water soluble. This is what? Stopping the oxygen. Patient need oxygen. Why do you want to stop it? Therefore, common sense tell you water would lubricate. Water soluble lubricant will lubricate the nose, and that will help with the patient to take care of themselves and feel much better. So that one is the right answer. As you can see, common sense trying to eliminate the answers at the same time use buzzwords. Number two, a nurse is providing discharge teaching to a client newly diagnosed with gastroesophageal reflux disease, right? Which of the following lifestyle modifications should the nurse include in the teaching? I don't know what is GERD, but let me look at the answers. Choose food that are low in fat. Maybe it's telling you something. Eat 3 large meals a day to reduce acid production. Is it a trap? Drink citric juice to increase vitamin C. Is that to a trap? I don't know. Limit caffeine to 1 cup and alcohol to 1 beer per day. Then at least I know you've learned something about reflux. That the 3-4 things that is associated with reflux is lower of the esophageal sphincter. If you lower the pressure, you're going to reflux. If you fill the stomach with a lot of food, you're going to reflux. If you irritate the stomach, you're going to reflux. If you put food in your stomach that leave quickly, you're going to do well. Therefore, which one do you think is the right answer? Fat stay in your stomach for a long time. So food high in fat is not good for reflux. 3 large meal, that means you increase the intra-abdominal pressure, and that will causes reflux in the stomach. Citric juice is an acidic, it's an irritant. Caffeine and alcohol are also irritant. Limiting it to 1 is not enough. Even if you want to pick 4, you can think that 4, 3, and 4 are saying the same thing. The best answer choice, no fat, as much as possible. So 1 is the best answer. It's the best of all. 4 has caffeine and alcohol. So you're taking both, which are all irritant. One say limit or choose food that is what? Low in fat, so that it cannot increase your intra-abdominal pressure. It doesn't stay there for a long time, able to get out of the system. So that's normal. Right answer for you right there. Number 3, What is the best nursing action? That means all the four are accurate, but one is the best one. And let's find the client crying alone after receiving a cancer diagnosis. What is the best nursing action? Best one. Buzzword, patient is crying. You got to be therapeutic. Do you offer to bring the chaplain to help with the therapeutic function? Tell them to not worry. You tell them to ignore what is going on. Sit quietly and offer what? Presence. Provide privacy. What will you do? Patient is crying. Diagnosis of cancer. Do you leave the room? Do you sit there and remain quiet and let the patient cry so that they know you're there? Or do you tell them not to worry or bring the chaplain? Therapeutic communication, but use common sense. If in this is the situation, you there, what would you do common sense wise? Comfort the patient. How do you comfort them? Your presence. Presence and empathy is the best way. Just being silent and sitting there is enough for the patient that you there without even saying words. Living for privacy is bad. Therefore, the right answer is number 3. For which food selection is appropriate, you got to know a little bit of content. And then it's reinforcing dietary teaching with the client prescribed with both full liquid diet. Which of this is a full liquid diet? Full liquid diet is something you cannot see through, right? Is that true? Yes. Clear liquid diet, you can see through. Full liquid, I cannot see through. Then you go to solid food or soft food. Apple slice, pudding, and ice cream. Cream, chicken soup, vanilla pudding, and peanut butter. Ice cream, strained soup, and yogurt. Tea, coffee, and jello. Do you know this? It's a GI, master your content, but at the same time, use your common sense. They say liquid. If it's liquid, it has to be liquid. I see tea, coffee, jello. They are all liquid. Jello will melt into a liquid. But tea and coffee and jello, they are clear liquid. So the answer choice is full liquid. I can see through. I can see through jello when it melts. Coffee, if you don't, although you can see through, they are all clear liquid. Ice cream, I can see through. Strained soup, I cannot see through. And yogurt, I cannot see through. And they are all what? Liquid. You see, both liquid and I cannot see through. 2, cream chicken soup, right? I cannot see through. It's a liquid. Vanilla pudding is a liquid. I cannot see through. But peanut butter is not a liquid. It's soft food. Therefore, it's eliminated. And number 1, apple slice is never even liquid, right? Pudding and ice cream are this. Therefore, which one? Number 3 is your right answer. Use that kind of strategy at the same time, test-taking strategy, at the same time, common sense to figure out what is going on. An older adult client has been hospitalized for 3 days. The nurse notes that the client is having difficulty sleeping at night and appear confused during the day and sleep at night confused. Sound like what? Delirium, right? What is the best interpretation by the nurse? What do you think? The client showing early signs of dementia. Something to tell you, right? The client may be experiencing hallucination. Keyword. The client is having difficulty coping with hospitalization. What do you think? The client is having disrupted sleep cycle due to environment. Step back. Forget about all this word. It's intimidating question, but you can figure it out. You said dementia, it doesn't happen acutely. This patient is admitted to the hospital, having problem and can't sleep. This cannot be dementia. It just happened acutely. Dementia will occur gradually. Therefore, that is eliminated. Even though the patient is confused, there's no evidence that he's having hallucination. The hallucination is a perception, right? Thought perception where you have like tactile, visual, other things, sensory deficits that you can see things that are not there. There's nothing telling you it's confused during the day occasionally, but there's nothing in the question that tells you this hallucination. The client is having difficulty coping with the hospital. This is a physical problem, not a psychological. So coping, we have no evidence of that is having psychological aspect in coming to the hospital. Therefore, based on that, number 4 is the right answer. That's what his sleep cycle is affected because he's in a hospital and he's having what? Delirium. These kind of questions, you got to step back and use common sense. He said, I'm using what they've given me to answer the question. I say that in every NCLEX question, the answer is in the question. And this is what it is. Every NCLEX question, the answer is in the question. 5 clients arrive in the emergency department at the same time. Which client most likely require immediate antibiotic therapy? Who's going to get antibiotic? Think about it. Infection, right? Common sense. Client with sprained ankle and mouth swelling. Do you see infection there? Client with closed fracture to the lower leg. Do you see any infection there? Client with sore throat, no fever, and negative rapid strep. Do you see infection there? Client with seasonal allergies and clear nasal discharge. Any infection there? Client with cat bite to the hand. Think, this is strategy, common sense. Sprained ankle and swelling, there's no open wound, no infection. 2, I use the word closed fracture. That means the fracture is not open. Just because you have a fracture, if I don't see the fracture, there's no need for antibiotic. You have sore throat, but you have no fever, and your rapid strep is negative. Therefore, it's maybe viral infection. Viral infection does not need antibiotic. Seasonal allergy, and your nose is running, good luck with that. The only person who needs antibiotic is number 5. You see? A 79-year-old client is admitted with Parkinson disease, bad problem. Which nursing intervention is most effective to prevent disuse syndrome? You say, what? What is this word? I don't know. Encourage at least 2 to 3 liters of water a day. Okay. Provide high-calorie diet. Okay. Provide weight-bearing exercise. Okay. Turning and positioning every 2 hours. Then go back. Common sense. I told you the answer is in the question, which is the buzzword. Preventing disuse syndrome. Then you say, what is disuse? That means I'm not using it. If you don't using any muscle or bone, it's going to break down. When it breaks down, it becomes disused. Therefore, what would you do to prevent disuse? Drinking water? Hey, every person needs water. It's going to help with their functioning, but it does not prevent disuse. You give them calorie, it does not prevent calorie. They need calorie. Weight-bearing exercise, you're stressing the bone and the muscle so that they can do the activity that will prevent disuse. Positioning them does not prevent disuse. Making the muscle work is an active movement, right? So provide weight-bearing exercise is the best one. So 3 is the best one. During morning care, the UAP reported reddening area of the client's heel. What is the most appropriate action for the nurse to take? Therefore, the UAP came to you and said the patient has redness on the heels. What would you do? Think about it. Do you document it and report? Document the report and then continue to care for the patient, or instruct the UAP to go apply a barrier cream to the area? Determine if the area requires further nursing intervention, or advise the UAP to keep the client off the heel during repositioning. What do you think? Put down your answer and use some common sense. You can think about it. You can say, oh, buzzword, I can see as a nurse, I need to do something. UAP told me something. They cannot do assessment. Therefore, I have to do assessment. Therefore, number 1 is not right. I got to do something. Right? Telling the UAP to take the heel off, you have not made an assessment. You got to go and see, verify what they've told you. Intervention is not going to help, right? This is the key. You determine the problem. Determination is a direct assessment. So assess before you intervene. So I will go and assess, determine if the area requires further intervention. Then we can apply some cream. That's number 3. A client on hospice care and is short of breath. Hospice, you're about to die, short of breath, right? Maybe he's dying. Which nursing action is the most appropriate to ease the breathing, right? CPR, fluid, high follow position, increase physical activity. He's dying, he has shortness of breath. Physical activity is not going to help him to improve with the breathing. CPR is on hospice. Don't put anything on the chest. If you do that, you are going to be in trouble. Probably is a DNR. So do not do CPR on a patient on hospice. It's going to die. Restricting fluid is not good for them. Based on that, you can tell that what 3 is the right answer. It all makes sense by just looking at as a choice. Okay, is breathing, comfort care, and raise your head up. That's all. And the last one, last 2, a client on bed rest complained of constipation. Keyword, constipation. Which next action is best to promote comfort and bowel movement? Once again, answer choice is in the question. Comfort and bowel movement. What are the things that improve your bowel function? Fluid, exercise, and what? Fiber. What do you think? Low fiber is no good. Encourage fluid intake is good. Giving patient morphine, more constipation. Restricting movement, more constipation. You can see these are all content. So restricting movement is not good. Giving them morphine is not good. Offering low fiber diet is not good. Right answer, encourage fluid. And the last one, and this is caring for a client with what partial hearing loss. The thing say hearing loss. Which of the following actions should the nurse will help promote effective communication? That means we can communicate. When somebody have hearing loss, they have other senses that they can use. The visual senses are good, right? The tactile senses are good. Therefore, speak clearly and slowly without shouting is the best answer so that the patient can hear you, right? Turn your back to the client while speaking to avoid eye contact. Wrong. You should face the patient so that they can use vision to see what you're saying. They can read your lips. Reduce background noise in the room before speaking. Yes, so that they can hear you. Use visual aids and written communication when necessary so that they can see what you're talking about. Stand in bright light so your face will light up so that they can see your face and read your lips. Speak directly into the client's ear at close range. Close range into the ear would distort the sound. I'll give you an explanation for all of them. NCLEX law of hearing loss because it's very, very important. These are the way they're going to trap you. Thank you for watching. And I know you've applied a little bit of common sense using your content to answer this question. Thank you very much. Good luck. Subscribe. Put the comments down, any questions that bother you, and let me know. And I will reply. Good luck in your exams. Best of luck.